And we are back with Cone Health's Dr. Jean Freeman, and we're talking about advanced care plans. So a lot of people would say, I don't even want to talk about that, but your perspective is, oh, it's a gift to your family when you talk about this.
I believe that sincerely. And the reason is, a lot of the times when I sit down with a family that has a loved one with serious illness, the family will tell me, you know, Gene, I really just want to do what it is that my mom or dad or brother or sister, husband, wife, whomever it is, whatever it is they want to do, I want to honor that. And so for families that have had the opportunity to have those conversations and fill out any documents and really have a good understanding, there's a lot of peace a lot of times with those decisions, because it's really just putting forth the plan that their loved one has said is important to them. Where I see families struggle is when I sit down with them and say, well, here's where we are and here's what's going on. And they say, you know, Gene, I really want to do what it is they want me to do. I just don't know what that is.
And sometimes at that point, they can't tell you what it is. I think a lot of people listening to this conversation would think this is for people who are sick, and you're saying, no, this is for every single person.
So the recommendation really is that anybody over the age of 18 have these sorts of documents completed and a plan in place. It is not just for the elderly. It is not just for somebody that's seriously ill. And so the reason is that number one, it outlines that care plan for your family. And number two, it ensures that if a time comes you're not able to advocate for yourself, what it is that's important to you with your medical care is clearly outlined to allow us to follow that plan that you want and set forth.
All right, so we're all going to be together for the holidays, which is a good time to bring something up when everybody's together and everybody can kind of talk about it, but it's a hard conversation to bring up. How do we do that?
So a lot of times it's a matter of looking for those opportunities. Unfortunately, with the human experience, sickness and death, it permeates our culture just because it's a big part of us as people. And so things like television shows, movies, articles in the newspaper, opportunities like this to sit down and see on the news broadcast about some sort of a advanced care plan thing really can lead to a segue to say, gosh, what is it you'd want in that situation? Some of the other things that can be helpful as well is if you go to the doctor's office, a lot of times on that little piece of paper they give you at the end, it'll say something about advanced care planning. So just as you're looking through that with your loved one, say, it says down here about this advanced care planning. Is that something that you've ever thought about? Maybe we should talk a little bit more about that as well.
I wonder if it would also help, like saying, well, I would want such and such. What would you want too, right? Because it's always like seems to be geared to the person who's older.
Absolutely. And that's been very well shown that a great way to engage in those difficult conversations is to be vulnerable up front and to say, you know, if there were ever a situation, here's what I want as far as my care goes. What are your thoughts on that?
Mm-hmm. Yeah. Okay. What about if the person doesn't want to talk about it at all?
So that's something where, as you mentioned yourself, sometimes sharing what your feelings and thoughts are can open that conversation. If not, if it's specifically about talking about being sick and dying, sometimes just talking about things that you value is a very helpful conversation to really have that in the back of our minds whenever we're trying to apply those values to medical care. Something else that can also be helpful is planting seeds. So if somebody's not really at a point where they're open to a full conversation, say, I know it can be scary to think about being sick, but I think it's important. Is that something you could think about? And maybe we can come back about and talk that at some point later in the future.
Mm-hmm, for sure. All right, so is having this conversation enough, or do you have to have the documents, or which one is more important than the other?
I think they actually go very well hand in hand. And the reason for that is that gives the best picture. The documents can outline, here's things I would and would not want. Discussions with family can outline values, because when you sit down and do any sort of paperwork, you can't really outline here's every single medical thing that could happen. And so by having that documentation in conjunction with those conversations, it really can help your loved one sit down with the medical provider to say, where we are now, in light of the medical situation, in light of the things that your family values, how do we work together to make that the best plan moving forward for them?
All right, we got just over a minute. So my last couple questions are, where do we find these documents that need to be completed, and then what do we do?
So the couple of things with that are, number one, you can talk to your primary care provider about these sorts of things. Always a great resource. The other place is that Cone Health actually has a website set up. I had nothing to do with this, so I cannot claim credit, but it's a great resource. And that's conehealth.com /advanced care. Forms are available. Also has just kind of a walkthrough on how to go about completing those, other things to think about. So really a great resource available there.
All right, tell me one more time what that web address is for that document.
Sure thing. Conehealth.com /advanced care.
Okay. All right. So thank you so much, Dr. Freeman, for kind of like laying all of this out and being so patient with us with all of these questions. We want to make sure that you get a full recap from today's Q&A on WFMYnews2.com, and you can get your questions answered. You can talk with your family about it. It's just a few minutes. We'll have it on our website. You'll click in the To Your Well-Being section.